Good afternoon, everyone. Hi, Mr. Johnson. Hi, Mrs. Richards.
Good day,
Thank you
Dr.
so
Robinson.
much. Thank you so much for allowing us to do this presentation. I'm going to go ahead and get started because there are quite a few slides to go through. So I will go ahead and start. So what I'm going to be presenting to you is just a brief summary of what took place in the recent outbreak and where we're at the moment as far as our COVID-19 situation in schools. So if you can go on to the next slide, Mr. Johnson.
Are you, sorry, I thought you were controlling the slides.
No.
We're straight.
Okay, great. Thank you so much. So as you can see, this is a graph, and I thought this graph was going to be very useful and very impactful. It shows the number of cases per day starting from the first wave last year to the recent outbreak we just experienced. And so it clearly illustrates that the recent outbreak spread very quickly and it was highly transmissible. So as you can see in the first wave, the most number of cases we had were a little bit over 20. And as you all recall, last year, at that point, we were all, oh, wow, 20 cases. It was quite, everyone was nervous about it because we didn't have too much information about COVID. And then we opened up our borders in June, and we did a fairly good job containing the spread. And so we didn't really have any outbreaks over the summer. And then school opened up, and November, December, we started to see clusters of cases. And as you can see, we had up to 40 cases in one day. And then we had a little reprise there in February. And then, of course, in March, we started to see, I think people just got a bit complacent, and we started to see lots of cases occur. And we were as high as 118 cases in one day. So I just thought this graph was really good to see because it shows us a good overview of what we've been through and what we're still going through. We are not out of the woods. We cannot let our guard down, and we are still in community transmission. Okay, next slide, please. So I wanted to show this graph as well. So this graph shows a breakdown of cases by age groups. And as you can see, we've had close to 300 cases between the ages of 0 to 19. And this recent outbreak affected more children compared to the last two waves that we had. And we also had teachers and staff members that were affected. Unfortunately, we don't have that breakdown, but they fall into some of these categories here that had, between 30 and 39 and up to 50 to 59. So we did see teachers and staff members affected as well. I just wanted to show this graph because you could just see that there were quite a few cases amongst school-age children. And you can move on to the next. Thank you. So this gives like a overview of what we just experienced. So 20 schools were impacted in this recent outbreak. I've broken it down so you can see there were 3 preschools, 8 primary schools, 2 middle schools, 1 high school, and 6 private schools. And I haven't mentioned that we also had several daycare centers and home care providers as well that were impacted. We directed 28 cohorts to quarantine and test, 3 of which were whole schools. And some of the principals of these schools know that, when we first started off, we did everything in our power to, just quarantine bubbles and classes. But unfortunately, the virus spread to different areas of the schools, so we had no choice. And we had to unfortunately quarantine whole schools. But the main objective was to try and keep as many schools open as possible. We had over 200 plus school associated cases with this recent outbreak. and exposure took place within the school, and we also saw exposures taking place outside in the community. And we started to detect the B117 variant, which is also the UK variant, from mid-February. And what we did notice is that this variant was prominently detected in most of the cases during this particular outbreak. And there were several reasons, several factors that why we had to quarantine so many cohorts. And some of them were due to mixing and merging of bubbles. I'm sure Marie discussed that with you all last week when she did her presentation. We had lack of consistency in mask wearing and social distancing. We had situations where classes, you know, they did such a good job with having their bubbles during instruction time, but unfortunately, when they went out to play or, you know, had some activity during lunchtime or play, they mixed with other bubbles. So that's something that we definitely have to do better in this time around now that we are back at school. And also mask wearing is so important. That also played a part when we were doing our risk assessments. What we also noticed was that some children, they were being sent to school with symptoms. And even some teachers attended school with symptoms. Mind you, they were very mild symptoms like headaches, stuffy nose, you know, allergy type symptoms. And that's what we were seeing with this particular variant this time around. With the second wave, what we did notice was, you know, the loss of smell, the diarrhea, vomiting. But this time around, you know, there were people that were having very mild, vague allergy type symptoms. And so it was really, really difficult to, you know, contain. So this recent outbreak impacted so many schools, and it impacted them either directly or indirectly. So like we had siblings or staff's children at other schools. And so it almost like forced the decision to go to remote learning. So yep, that's pretty much a breakdown of what we've just recently experienced. I'll take questions at the end, or how do you want to do this, Mr. Johnson?
We can take questions at the end.
Okay.
I mean, people can type in their questions whenever they want to.
Okay, great. I believe it's Marie. Are you going to just highlight a few areas with your slides, or do you
Yes,
want? Okay, great.
thanks, Dan.
No problem.
Excuse me. Good afternoon, everyone. So I just wanted to highlight a few of the safety and health protocols. Sorry, I have a frog in my throat. Excuse me. So the Department of Health just wanted to reassure schools that there are no substantive changes in the government of Bermuda school safety and health protocols. The chief medical officer wanted us to stress with you how critically it is that teachers really strictly adhere to the protocols 100% of the time. So back to what Nurse Jen said, the mask wearing, even back to December, mask wearing was a bit dicey. It was a bit patchy leading right up to our last outbreak. So in my visits to school since Monday, I have seen a huge improvement, even with the children. I was at a school this morning and a little boy's mask, he had it off of his ear, one ear, and he was hanging up his bag on his hook. And I said, "Oh, don't forget to put your mask on." He turned and said, "Oh, we can take it off when we get to our class." And it was just so fantastic that he remembered that. He wasn't quite in his class yet, but thank you, teachers, for reiterating the message. So even he was a P2 student. So even your youngest students can gain a greater understanding of the importance of how we can protect one another. Okay, next slide, please. Thank you. So each individual staff member comes from a different household, of course, and therefore everyone has to wear a mask properly at all times to protect others. And this means even if a teacher is 6 feet or more physically distanced from students in the classroom, the mask still has to be worn So in other words, the 6 feet rule does not apply in classrooms or offices or indoors in general as the reason to remove a face mask. So in other words, even if you're 6 feet or more from someone in the classroom, you still have to keep your mask on due to the more infectious nature of this UK strain. Okay, so just reiterating, teachers and staff must wear their face masks all day. Next slide, please. So another critical practice is students wearing their masks. So just asking you to continue to remind students to wear their masks while they're waiting in line to enter the school campus or the buildings in the morning, during entry and exit, when they're moving around the building, riding on a minibus, any form of public transportation, or carpooling with students from other households. I was at a school this morning. Here comes the minibus. The driver has his mask down here, and I gestured to him to pull it up. He just looks at me. There's a boy sitting right behind him, no mask on. It was confusing to me. And I did go over and speak to him, and he said he understood. And so we're still emphasizing that middle and senior school students be closely monitored to ensure that they wear their masks properly over their nose and mouth. We're just seeing a lot of masks under the nose, on the chin, or it slips down when one is talking and it's never replaced. So it's just heightening that awareness, and especially our students will need some gentle reminders. Okay, next slide, please. So here's another critical practice when socializing with others in schools or in buildings. We're just asking that teachers, when you're moving around the school buildings, you continue to do so responsibly, including not entering other classrooms or office areas to socialize. We know if you have to go into a classroom, if there's no coverage and there's no substitute teacher, then teachers in the staff may be asked to cover. That's different than socializing or going into a classroom to eat lunch with one another. In that situation, your masks are all removed and you're speaking and producing air droplets that can affect one another. And right now, excuse me, the Department of Health is stressing that there are no longer considerations for social bubbles as a reason for people being able to mix and merge with one another. Social bubbles are no longer a part of our strategy in shared spaces. So the concept of having a school bubble necessarily won't hold true in most schools and in most settings and offices as well. So avoiding certain socializing instances where face masks are removed while indoors should be avoided except when eating or drinking, while not sitting across from anyone. So if you're sitting next to someone more than 3 feet, we're going to ask you to aim for 6 feet. So if you're eating in the staff room, and I do know most teachers are not eating in the staff room any longer, but if you are eating together, even outdoors, still give yourself some space. Being outdoors does not completely eliminate your risk, it just reduces it. So you still have to maintain the 6 feet distancing, even outdoors, because you'll have your mask off while you're eating or drinking. I'm not sure if there's another slide. Oh yeah, most important. Okay, class bubbles. So in preschools, primary and middle schools, sorry everybody, hope I'm not getting sick. An individual class represents a class bubble. Schools will continue to maintain individual class bubbles, not mixing or merging them for any reason, even for PE class or outdoor play. Preschools, primary and middle schools will not combine the classes in a year level to form 1 year level bubble or pod. So some schools are using the term year level bubble or a year level pod, or they're grouping children according to their ability level and calling that a pod or a bubble. There are many different permutations, which we learned during the risk assessments. Excuse me. In primary and middle schools, Encore teachers and health teachers will continue to come into classrooms with no students leaving the classroom for these classes. Okay, next slide. In middle schools, 1 or 2 Encore subjects can be provided per day to each class bubble, whereby students continue to wear their face masks and are clearly monitored while walking in a predetermined direction to their Encore class or classes. There will be no combining of students from different classes to form an Encore class. Teachers will remain with or in their own class bubble throughout the day. Only scheduled peripatetic therapists and specialist teachers wearing face masks will enter classrooms in the morning only. And I forgot to add in school, I put it in the next line. In my original slide, I didn't have it, so I'll continue. None of the specialist teachers or peripatetic therapists can enter classrooms in the afternoon. In-school staff can enter classrooms in the morning and afternoon. Oops, typo. All will wash or sanitize their hands before entering a classroom and maintain physical distancing from all students except any student who requires assistance. So whichever student they've entered the class to work with, whether it be the visual impaired teacher, the deaf and hard of hearing teacher, the school counselor, and what have you. Principals will wear their face masks if entering classrooms as needed and record all classrooms entered with the date and time if contact tracing is required. Principals will wash or sanitize their hands before they enter the classroom. And I can't see the bottom of the slide.
And maintain physical distancing.
Thank you, and maintain the physical distancing. Thank you, Mr. Johnson. Okay. And this, Nurse Jen already touched on this issue. We found that there was a level of poor adherence to the protocol. Some schools did much better than others. So Nurse Jen mentioned the Department of Health having to quarantine whole schools, many cohorts and staff members during the March to April 2021 COVID-19 wave, as there were many instances of poor adherence to the protocols. As a result, numbers of students and staff were exposed to one another, which made contact tracing extremely difficult. Some schools merged 2 or more class bubbles during core and encore classes and indoor PE classes. Some teachers socialized with colleagues and entered classrooms other than their own to eat lunch, mixing with many colleagues. Some staff did not wear their masks in their own or other classrooms, in hallways and staff rooms. The Department of Health strongly advises that sick students and teachers stay at home. Please. Thank you.
Okay, who's
There may be a challenge with unmuting.
okay? Who is doing this section?
I think
Nurse Kelly.
one of the
Nurse
nurses.
Kelly. Mhm.
Sorry, who was that? Nurse who, Mrs. Richards?
Nurse Kelly Crampton.
Okay, I can't see that name.
Right, but Mr. Johnson, I think Nurse Robinson's name is showing on the screen. If you can unmute there. I think all of the nurses are in one room.
Yeah, I mean, they can unmute themselves now.
Good day, everyone. The school nurses will be presenting on the outbreak response plan and the vaccine campaign. My name is Alison Maycock. Myself, together with Kelly Crampton, will be presenting on the outbreak response plan. Next slide, please. So the objective would be to recap and reinforce the outbreak action plan to ensure fluidity and clear understanding of our roles and responsibility, to refamiliarize ourselves with the letters that will be distributed during an outbreak or during risk assessment for the purpose of educating the parents and caregivers, and to distinguish between screening, testing, and investigative testing. So the roles and responsibilities of the stakeholders that will be discussed at the Child Health Department, Epidemiology and Surveillance Unit, Ministry of Education, and the parent. Most of you would have already been operating in the capacity of your role and responsibilities as identified from last year. So this will just be a recap. We must also commend everyone in their assistance in reporting and management and mitigating the COVID-19 effect in your respective facility. The Child Health Department will continue to aid in the prevention and preparedness by utilizing PowerSchool for the daily absence illness surveillance. So therefore, it is necessary that the correct illness codes are utilized on PowerSchool. The Child Health Department will also perform COVID-19 protocol checks, and the department encourages staff and parents to download the We Health app to assist with contact tracing during an outbreak. Child Health Department personnel will contact the school upon verification with Epi and Surveillance Unit if a staff, student, or essential visitor is identified with COVID-19. The department is also responsible for outbreak assessment. So the Department of Health will investigate cluster of cases associated with the school location. They will perform on-site visits, attend PTA Zoom meeting if needed to answer COVID-19 related concerns, and follow up on staff student understanding of COVID-19 testing. The Epidemiology and Surveillance Unit, they are responsible for coordination, surveillance, guidance, outbreak management, and communication. Next slide, please. The Ministry of Health role and responsibility would be to provide legislation and policy oversight, to continue providing support to the schools and the public. The Ministry of Education are responsible for developing policies and guidance for remote learning, to maintain up-to-date MOED website for entry and exit protocols and any changes affecting students, parents, caregivers, and staff. Support schools with human resources during outbreak and distribute public health measure signage. Next slide, please. The roles and responsibilities of the school would be to implement prevention measures found in the guidance documents provided by the Ministry of Health at the website and in the entry to exit protocols for school levels. Contact Child Health team if there are any concerns about student-related absences within school community, and contact the Epi and Surveillance Unit if any cases of COVID-19 are reported. The school is also responsible for maintaining accurate records of staff and students using Power School, and provide Department of Health and Ministry of Health with a designated contact person for use during and or after school hours. The role and responsibility of the parent and caregivers. Do not send they should not send their child to school if they are sick. They can utilize the government patient symptom checklist found online, follow up health measures and entry-exit protocols. They should also be encouraged to download the WeHealth app, provide school with updated contact information. We ask that all the schools request parents to provide updated email address that they are able to so that they are able to access emails from home. We have had a lot of incidences where they said they can't access their email because it was sent to their work email. So if they have a personal email address, that would be preferred. Or if possible, set up a WhatsApp communication forum or some other forum that the school will be able to communicate more efficiently or effectively with the parents. And they should keep informed by thoroughly reading the emails or letters sent from the school. Kelly will now continue with the next slides.
Okay, so just going to quickly go through the steps during an outbreak. So when there's one confirmed case, whether it's a staff member, student, or visitor that's associated with the school, ESU and the designated school nurse will be notified immediately. It's preferable for the parents of the affected student or the staff member to advise the school when they test positive first. The designated school nurse will collaborate with ESU and follow up to notify the school about the potential for exposure. The outbreak response team will contact the close contacts that were during the infectious period. This can include members of the household, the school bubble, substitute teachers, school and extracurricular activities, morning and after school care, carpool, and they will be informed of the 14-day quarantine to minimize their contact with the vulnerable population, self-monitor for symptoms and test for COVID-19, and inform their doctor of any symptoms. The contact tracer will also identify any casual contacts and provide advice to them, essentially to avoid close space, close contact, and self-monitor for symptoms for 14 days. And if at that point they were to become symptomatic, to inform their doctor, isolate, and then test for COVID-19. Next slide. So when there are 2 or more confirmed cases at a school, the outbreak response team will assess to determine the epidemiological link between the 2 cases and then the potential for further spread between these unrelated cases. The school will be designated as having an outbreak, and school principals would restrict visitation and mixing of groups and immediately commence the canceling of activities. The team may decide to close the school if there are more than 2 persons who are epidemiologically linked. Also, if there are not staff or students in attendance to make schooling feasible for safety and instruction based on the number of parents and households that are under quarantine. Surveillance will be done through monitoring of absenteeism and daily activity surveillance of any respiratory illnesses. And communication will be completed with letters sent to the school. ESU will provide these letters for the school administration to disseminate with the individuals that are affected by this outbreak. The decision by ESU to reopen schools will be based on multiple things, including community-wide transmission, the capacity of the hospital, the burden of the illness, the number of new epidemiologically linked cases, number of schools affected, and the vulnerability of the schools. And then monitoring will continue when the schools reopen. Next slide. So just a quick summary of the Ministry of Health letters that can be sent out. So the first one would be a risk assessment letter, and it essentially confirms there's a positive case associated with a school or a childcare facility. An investigation into how the school has been affected by the positive case is being conducted at that point. So once receiving this letter, individuals will just be on standby for further instruction. Next, the public health instruction letter is sent to specific individuals affected by the confirmed COVID-19 case with instructions to quarantine and test. An update letter could be sent out, so it would alert of any changes to the public health instruction letter, and it could indicate that there's a lesser or greater risk, which occasionally depends on the results of that initial test out. A release letter would be sent when day 14 test results from an affected school or facility have been received. All the quarantined students, families, and staff that have received a negative day 14 test result can at that point be released from quarantine. And Ali touched on this, but just reminding parents that it's very important to check all email folders as well and to be alert for correspondence at that time. There have been some reports of emails going into junk or spam folders. And then it's also important that the parents are aware that all of this information that's being relayed is anonymous and confidential. Next slide. So screening testing is a non-invasive saliva or buccal, so within the cheek area there, to screen a large number of individuals that do not have symptoms or have not had any contact with a positive case. So these individuals would not need to quarantine while they're waiting their results, and any screening test that results in a positive needs to be confirmed with an investigative or diagnostic test. So an investigative or diagnostic test is an oropharyngeal or nasopharyngeal test that's completed when an individual is symptomatic or is considered a close contact of a positive case. The Ministry of Education is coordinating routine screening testing, and if a positive result is identified, a risk assessment will be performed and investigative testing will be required for that bubble, despite having a previous negative screening test.
Good afternoon, everyone. I'm Nurse Tina, and I'll be presenting the vaccine campaign. Next slide. Vaccination is recognized globally as one of the single most important measures that individuals can take to protect themselves, their loved ones, and their community. Vaccines stimulate the human's body's own protective immune response so that if a person is infected with a pathogen that's a microorganism that causes the disease, the immune system can quickly prevent the infection from spreading within the body. Vaccines mimic natural infection, but without causing a person to become very ill. Who should be vaccinated? All Bermuda residents play an important role in helping reduce the spread of the coronavirus. While not mandatory, the Ministry of Health strongly urges all individuals to get the coronavirus vaccination. All persons, that is staff and students aged 16 years and older for the Pfizer and 18 years and older for the AstraZeneca, are encouraged to have the COVID vaccination. It is important to note that both doses are required to be given 3 weeks apart, that's for the Pfizer, and 8 to 12 weeks apart for the AstraZeneca vaccine to be effective. Pfizer BioNTech is currently in use. We're presently phasing out and moving on to the AstraZeneca. The vaccination process involves clients can register for appointments by going to the link that's above there. If they need to reschedule, they should call 444-2498 or email vaccine@gov.bm. Walk-ins are welcomed at the mobile COVID vaccination sites to find out where they are and when the next mobile COVID vaccination site will be. Clients should check the government website. Mobile sites are operational from 10 a.m. to 2 p.m. Some important things to know about the vaccination process includes The vaccine is administered in the upper arm, approximately 2 inches beneath the shoulder joint. Dress appropriately by wearing clothing that is easily rolled up or exposes your upper arm. Depending on the number of walk-in clients and traffic delays can be expected. Vaccination centers have been designed based on international medical best practice and has been laid out to ensure patients' comfort and safety. The vaccination process will take about 20 to 30 minutes and consists of the following steps. Upon entry, the clients are required to present their ID, which is the Bermuda driver's license or proof of residency, have their temperature taken, and sanitize their hands. Clients will be provided with a consent form and asked to complete their personal details. Clients will be directed to the next station where their personal details are verified and checked against those in the system. Clients are then directed to a vaccination booth where a trained medical professional will confirm accurate personal details, ask additional health-related questions, provide health education, administer the vaccine, and provide a signed vaccination card. Upon confirmation of the vaccination, clients will automatically be booked for the second vaccine appointment and should receive an email confirmation. Clients will be directed to an observation area where they will be asked to sit and relax for 15 minutes. This is to monitor for adverse reactions to the vaccine. Side effects and risks. Most persons do not have any reactions after receiving the first vaccine. However, this doesn't mean reactions will not happen after all. When the reactions do occur, they tend to be mild and resolve with little or no intervention. Minor reactions include soreness or redness and itching where the shot was given, headaches, tiredness and muscle aches, chills, and joint pain for some persons, fever, nausea, and feeling unwell. If these reactions occur, they usually begin soon after the shot and last 1 to 2 days. Side effects have become more commonly reported after the second shot. Severe allergic reactions include hives, swelling of the face or throat, difficulty breathing, fast heartbeat, dizziness, weakness, and these usually occur within a few minutes to an hour after the vaccination. There are trained medical personnel available to assist any clients having an adverse reaction while they are at the vaccine site. These include physicians, nurses, and EMTs. In the extremely rare situation of an adverse allergic reaction while in the observation area, the medical personnel have access to all appropriate equipment and supplies and will be able to take the appropriate actions to ensure the client's safety. If a client experiences a minor reaction, once they leave the vaccine site, we recommend rest, hydration, over-the-counter pain relief, and in case of severe reactions, the client should contact their doctor immediately or call 911. Thank you.
Thank you so much, nurses and health officials. I'm going to go straight to the questions. We had a few coming in during the presentation. Okay, so one of the first questions was concerning the testing. What is the percentage of false positives? Does anybody want to take that?
Mr. Johnson, we don't have that information with us regarding any false positives or anything, but we can try and get that information for you. But at this present time, we don't have that information.
If I can say, thank you so much. We did speak to Dr. Karika Weldon yesterday and the day before, and her view was that this contamination may create a false positive, but the test itself does not yield false positives. We recorded that presentation and we will be putting it on the YouTube channel. So if anybody knows that YouTube channel, subscribe to it and hit the notification bell so you can get answers to questions like that on our YouTube channel. It's called Bermuda Public Schools. Okay, so this next question was about are there any negative effects to wearing the mask for children or for adults?
Marie, do you want to take that? You're muted, Marie.
Thanks, Jen. I didn't want to jump in case you wanted to tackle that. Do you know of any medical reasons? I can share my thoughts. Are there any medical reasons, Jen?
No, just it's not recommended when you are doing high exertion activities when you're working out. And even for children, we do have guidance on children. And I know you're going to talk about that, Marie. But yeah, so there isn't really any major medical reasons. But you could discuss the guidance for children.
Okay, thanks, Jen. Children 2 and older can wear masks. I have seen them out and about, but I do know quite a few people have a lot of misgivings about that. If the rule of thumb is that if a child can't put their mask on by themselves, and then they can't be relied upon to take it off, or vice versa. If they can't independently operate the mask, donning, putting it on, or doffing it, taking it off, then they shouldn't wear it. The other issue would be the length of time. So the October iterations of the entry to exit protocols do lay out suggestions for mask breaks, or I call them breathing breaks, but mask breaks. I do know teachers have been very creative about how they do that. Department of Health would just want now, especially with the UK strain, not for teachers to have everyone take their mask off indoors at the same time for a mask break for the middle and senior school students. Department of Health did discuss the feasibility and safety of preschool and primary school age children having to start to wear their masks. And we have decided no at this time. The risks outweigh the benefits. If that position changes, we will certainly let the schools know. We are emphasizing the need to wear masks when indoors for middle and senior school age children, as well as all staff. But from a personal point of view, if a teacher or staff member feels overcome, they can certainly step outside in the hallway. I have to do it sometimes when I'm at the schools. I typically would just pull my mask away. You're not supposed to do that, but I'm asthmatic, and I think that's what's happening to me now, and have allergies. You can certainly take one ear loop off. You're out in the hallway, take it off. No one else is within 6 feet of you. Take some deep breaths and just get yourself back to where you need to be. Unfortunately, we don't have any wiggle room for removing the mask unless you can get a certificate from your doctor. The other issue would be not substituting a face shield for a face mask. The face shields don't seal around its edges, so air droplets could in fact come up around and under the sides of the face shield. So I did investigate that last year when we were first looking at what would work for schools, and really only a mask that is snug to the face, the cheeks, over the nose, and around the chin should be worn. So again, if you're having adverse effects from the mask wearing, certainly try to give yourself some breathing breaks. You can also have outdoor classes. That's in the protocols. That's in the entry to exit protocols. You and your colleagues at your school can decide who's going to use which outdoor area so that, it runs smoothly. The area should be sheltered, obviously. You don't want the sun beaming down hard on you. So you can have your outdoor classes. You do not have to be indoor all the time. Some schools have lovely outdoor type of hallways that are covered. You may be able to use those as well. But if you really feel sick and the masks aren't working for you, you would need a doctor's note for that to excuse yourself. And then
Great.
the Department of Health can assist you with finding another alternative.
Okay, there are quite a few questions, so and I know
Okay.
people have to be out of their buildings soon, so we need to sort of speed it up.
Yeah.
What is the expectation of the Department of Education on the frequency of disinfection measures throughout the school day? That's in reference to students' inability to maintain bubbles when using common bathrooms in the schools.
Well, as far as I know from Mr. Casey and Mr. Salters, all of the custodians have been given instructions. Some schools have external extra cleaners that have been there, some of them since September. So they have received their instructions to, I've seen them walking around, wiping off doorknobs, the door push plates, cleaning the bathrooms. Minimally cleaning the bathroom should take place at least mid-morning, after lunch, and of course, a bigger cleaning at the end of the day. Older students can wipe their desks off at different transitions in the classroom. Most teachers, from my conversations with them, make sure either if they have the time to do it or it's split. It's no one person's responsibility within the classroom.
Okay, thank you. Can we clarification is being asked for here about, will school counselors only be allowed to enter the classrooms in the morning, and how many classrooms per day can they enter?
Oh, that's a great question. If the school counselor works at just that school, the counselor can go to whatever classes that need to be gone into to work with the students. If the counselor is peripathetic or itinerant, then they can attend one school in the morning, one school in the afternoon, and they can only go into classrooms in the morning, but they can do pull-out in both schools, morning and afternoon.
Great. And what's a recourse if a parent insists on sending their child to school when they might be unwell, or if they refuse to collect their child, until the end of the school day when they might have symptoms while at school? Mrs. Richards, I think that's for you.
Thank you, Mr. Johnson. I was just processing that. In the first instance, if a student arrives at school and the school staff notice that perhaps the student is unwell, the parent should be contacted. The student should be taken to the isolation room. All schools have been asked to have that isolation room. If the call goes out and the parent does not come, I think that was part of the question. If the parent is not responsive and does not come to collect the child will need to remain in the isolation room while someone on staff continues to work with or reach out to the parent to come and to get the child.
Okay.
Thank you, Mr. Johnson. Can I just add to that?
Yeah.
Thank you. Thank you, Commissioner. With respect to what you just said, if the parent shares that they don't have anyone at home to watch them, they have to work, how is that handled?
It puts the school in a very difficult position, but I think you have to continue to reach out to the parent, and someone has to be identified to come and to collect the student. And so, when a parent says, well, I don't have anyone, they have to come, or they're going to have to identify someone who will come to collect the child. And I think the school has to persist. Meanwhile, the student has to remain in the isolation room away from other students. It's a very difficult situation for schools to be in. I recall being a principal, and there were times when we had to call parents, and sometimes it was challenging to get into contact with them, or to have them come and to collect a child. But we had to continue to persist with, linking with them and putting pressure on them to come in to collect the child.
Thank you very much.
Mr. Johnson?
Yes.
It's Ms. Beach. I just wanted to say one very brief comment. Schools still need to make sure that the isolation room is kept clean, even if no one gets sick for a week. Sometimes during the inspections, we've gone into the cleanliness inspections. We've gone into the isolation room and it isn't clean. So it wouldn't be ready for anyone who becomes ill.
Thank you very much. Will the Department of Health be updating safety and health guidelines for schools and parents? And that's related to this question about parents not picking up their school when. So is there more we can do to just emphasize that for parents, that they have to do this?
Yeah.
What is our ability to host hybrid in-person and online classes? Some parents have asking about about learning from home. Some teachers do not mind working from home if permitted. They're saying that the Wi-Fi at schools can be very poor sometimes.
Mr. Johnson, I will take that question, but I need you to can you read it again, please, so that I'm clear about what is being asked?
Well, there are parents who want to have their children learn from home, and there are teachers who do not mind working from home. And so the question is, can that be accommodated, basically? Wi-Fi at school can be quite poor, this person says.
Thank you for the question. There are two areas that I would focus on with respect to that question. And I would start by saying that the Education Act requires children to be in school. A parent who makes a decision to keep their child at home is a parent who is not in compliance with the Education Act. So if a parent decides that he or she will keep a child at home, and they make that decision, but they reach out to the school and ask for remote, for the student to have access to remote learning, it is our position at the department that request is not to be honored. We allow for remote learning for students who are extremely clinically vulnerable. And that would be students whose doctors have submitted letters to us or to the Department of Health where we've verified that they do fall into that category. Once the Department of Health reviews it and they indicate that the student is indeed extremely clinically vulnerable, the school is then informed that that student can have access to remote teaching, a remote teaching and learning experience. But for a parent who says, I'm not sending my child to school, the Bermuda Public School system does not offer or provide remote learning under those circumstances. We did send a newsletter out to parents last week, and we stepped out in the Scoop newsletter the conditions under which remote learning would be provided, and it is only for children who are extremely clinically vulnerable. Children who are out of school for short or longer periods of time who are not extremely clinically vulnerable, their parents must provide a doctor's certificate. And in those instances, those students will receive tasks by email or by mail, and they may receive learning packets. But a parent who decides, I've made a decision myself, I'm not sending my child, that does not fall within the conditions and the arrangements that we have in place for the Bermuda Public School system. I hope that helps clarify.
The letters, who gets the release? I think this means the consent letters for these, the release letters. Who gets the release letters? That's the only question I have.
Release from quarantine.
Right,
From
I can
quarantine.
answer that. Yep, I can answer that. So the release letters will be provided to the group, the cohort group that were directed to be in quarantine and will need to test out. And as soon as we get their test results, we can verify that, you know, if it's back negative, then they will be given a release letter. And so we at ESU will provide the principals with a list to say who can be released. So it gets verified from us first.
Thank you very much.
Does that answer your question, Ms. Simmons?
Yes, yes, it does. Thank you. Because it just happened before where a person didn't get a release letter, but the principal did. So it's the principal who then sends it on to the staff.
That's correct.
Okay. Thank you.
Great.
No problem.
And a question about the vaccine. Which groups are most at risk for adverse effects? Is the UK not recommending the vaccine for under 40s? Is that correct? What is the recommendation in Bermuda?
Okay, thank you for that question. Basically, the recommendation for the vaccine as we presented is for the Pfizer, age group 16 years and older. For the AstraZeneca, it's 18 years and older. And that's what we have available right now in Bermuda, and that's what we are using. There is nobody who cannot get any health conditions, persons with allergic reactions to the components of the Pfizer will get the AstraZeneca vaccine. If you have a first dose of the Pfizer vaccine and have an adverse event, you will not receive your second dose.
Thank you very much. What is the procedure for the vaccination certificate?
To request the vaccination certificate, the person will need to email vaccine@gov.bm, their administration card, a copy of their administration card. That's a card that's given to you when you complete your vaccination first and second dose, along with your identification card. This email is sent, the information should be verified, and then the certificate is emailed towards you.
Thank you. And do we know the percentage of BPS, Bermuda Public Schools staff and students tested before returning to school? Mrs. Richards,
No,
we did ask.
I don't know that. Dr. Weldon would be able to assist you with that, Mr. Johnson. I don't have that.
Okay, thank you. Given the fact that there are other areas besides the school system where spread can occur, is there going to be a stronger campaign considered? In other words, beyond schools? Can anybody answer that question?
Can you please clarify that for testing, or what was the question again?
For managing the pandemic, I guess, you know, I mean, it's there are right now we're focused on schools. They're saying that schools are not the only places where the virus can spread. So there's neighborhoods, there's social clubs, etc. Is there a campaign in the works to address, you know, those different types of areas?
So at the moment, I think everybody has to take responsibility for following public health measures. And so this is a unified approach. Not only is it for schools, but it's for everyone in Bermuda. So I don't think we're just targeting one particular area. It's for everyone to follow all of the public health measures, and any guidance or recommendations that are provided by the Ministry of Health, we advise that you follow them as much as possible. And, you know, it's so easy to sort of, when you don't see cases, get really comfortable and become complacent. And so I think that's what ends up happening, is that people get really comfortable when they see that, that there aren't too many cases. And so they start removing masks and having more gatherings. And so I think we just all have to just be aware that we have to follow all of the public health measures. So it's for everybody, not just for one particular group.
Great. Another question. Are peripathetic staff allowed to be in school all day if they're only working with one student in a separate room away from other classrooms?
Yes.
Great. Nice short answer to the point. Thank you. Is a viral, sorry, we're running out of time, but there's a few more questions. Is a viral load different for children who are symptomatic? Is that a question any of you can answer?
No, I don't think. I think the best person to answer that would be Dr. Weldon, who looks at the viral loads on a regular basis. But I think I don't think we should be emphasizing on the viral loads. I think we just need to make sure that we are getting tested, we are remaining in quarantine, and following all the measures in order to contain the virus.
Thank you. What's the process used to inform, the process used by the Ministry of Health to inform the Ministry of Education of positive cases among the students?
So I can answer that because I'm the main person that usually informs the principals. The epidemiology and surveillance unit are given the information when cases do arise. And so as soon as we have a case, we verify that with case management. The school surveillance team, I should say, verifies that with case management, get the information, and then we will contact the principal of the school. There are instances where a parent will contact the school first and let the school know. So the school is already aware by the time we get to them. So that's the usual process. It would be either through the parent or it would be through our team, our surveillance team at ESU.
Great. There's a complaints question here. Why are there never enough sanitizer and desk wipes at schools?
Mr. Johnson, I can answer that question. We do have a system and a process in place for schools to order supplies on an ongoing basis, and stores delivers them on an ongoing basis. So we do have a process in place, and hand sanitizer, bottles of sanitizer, wipes, etc. Stores does keep those supplies in stock, and so they are available.
Okay, and if they notice that the stocks are low, they should just let them know that, right?
Well, we do want orders to come in before they are depleted. So when they are starting, to run low, then the requests can come in. And as I said, stores team, they make deliveries every week.
Great. And a question about high school, the senior school. Can they continue to stay at home and do remote learning as usual? Has that changed at all?
The senior schools have a set schedule. Students who are 16 and under are required to be on site for in-person learning. The other students rotate through certain days. And I hope I'm getting to what the person is trying to determine. If you're asking if students decide to stay home on the days when they are not, when they are required to be in school, and then should they have access to remote learning, the answer is no. They cannot make decisions to change their own schedule and decide that, I want to stay home today because I have access to remote learning these 2 days, but I also want to stay home today, which is not the days for remote learning. And should they have access to that, the response is no. They need to follow their schedules.
Okay, he was asking mainly about the senior for S4 students.
I'm thinking, and if that is what was being asked, then if I didn't answer the question, and maybe you can put the question in the chat again so that we can make sure that I can make sure I'm answering the question. But that's how I was interpreting the question.
Okay, so I'm going to copy it because it was sent to me privately. Another question is about, we're almost there. So, oh, good, there's a lot more questions. What's the address? Vaccines@gov.bm? Oh, we've already answered that. Or vaccine@gov.bm. And it's vaccine@gov.bm, no S. If a student is positive with the saliva test, do they have to have the nasal test?
Yes.
Yeah, thank you. It's confirmed by the other test, right? Is Bermuda,
Correct.
thank you very much. Is Bermuda taking any notice of the places that have suspended the use of AstraZeneca because of the deaths, etc.? Now, there's been issues with AstraZeneca. Is that over now?
Basically, there is no decision made where that is concerned right now. Clients are reviewed before they're given their vaccine. There's a screening that's done for everybody individually, and there is no research that is saying that it is affecting anybody at this stage that we need to be concerned about those that's happening right now.
Okay. Does the Health and Education Ministry have a system that they use to notify sibling schools to be on alert to take proactive measures to prevent school outbreaks like we recently experienced? Example, if a middle school has a positive case or outbreak within a class or a bubble, do the primary schools or vice versa that possibly be directly affected get notified as well to look out for certain siblings?
Mr. Johnson, I can say that the Department of Education would not be in a position to do that. We don't know who the children are or who the adults are. We don't have that information. It's not provided to us.
Yeah, can I add to that, Mrs. Richards? So when parents do inform the schools that their child has to stay home due to quarantine, they can, that's another way of advising, because there are parents that do call schools and tell them that their children have tested positive. And so in the last outbreak that we experienced, that was a way of how the other schools were finding out. And I'm going to be very honest, during the outbreaks, when we were dealing with 3 or 4 schools in one day, it's just, we're not able to get to that point. We're not able to give that information because it has to come also from case management. So they give us who the case is. Now, sometimes they will let us know if there are siblings in other schools, and we're able to advise the parents to inform the school that yes, their children are having to stay home due to quarantine. But it's a way that we definitely have to look at to communicate better. But I understand with Mrs. Richards, there is a confidentiality aspect as well, and so we have to be very careful when we do that.
Okay, will there be signage for the minibuses that are collecting students after school? Teachers and students do not have confirmation of the persons driving the minibuses.
Yes, we just had some signage printed. I have started to deliver to schools. So yes, there is signage.
Okay. And there's a question here about the percentage of parents that have working emails that they check and respond to. Well, Mrs. Richards, that's really a function of Power School take-up, isn't it?
It is, and what our data management person for Power School does is to actually go in at intervals and pull down the data and to do a check. When there are issues with emails that are identified, he then notifies the respective schools, and then those schools are asked to make contact with the parents to get the correct information, and then the schools would then input the correct email addresses into Power School.
Okay, another question. What is the threshold for shutting down a school? So how many positive cases within a school is it deemed necessary to close a school for further data collection?
Well, it's many factors. It's not just about the numbers. It's about the resources. Does the school have the resources to, be able to teach and have enough substitute teachers? I know at the last outbreak, I know that there were several teachers that had to quarantine, and so it's a struggle to try and find substitute teachers because they were substituting in schools that were affected, so they couldn't go and substitute in other schools. So it's not about numbers. It's also about the resources and the amount of children that are having to be quarantined, etc.
Great. Is the ministry sending the permission slips out for students and staff testing at each of the schools? And if so, when will schools be receiving them?
There will be, is this in reference to the saliva testing program?
Yeah, I think so.
Yes, there is one electronic form for the system. That was the link to that form was sent to principals this afternoon after 3, so that it could be sent to parents. Parents will have up until Saturday at 8 p.m. to access the form. And then that information will be downloaded, and then the individual information or the information per school will be sent out to each pre-primary, middle, senior, DAME, and Success Academy on Monday. And so schools will have an indication of which students have which students' parents have given them consent for the saliva testing.
Okay. Can we talk about the disinfecting measures taken by the ministry to ensure that a class is safe after a COVID outbreak in that class or school?
Commissioner, did you want me to answer that?
Yes, and I was going to ask Ms. Beach because she's intricately involved in that process.
Okay, thank you, Commissioner. So right now we have the affected classrooms or any room that the affected person had entered that we are aware of, and we gather some of that information during the risk assessment. So that room or those rooms are immediately sealed and locked. And then after a day or two, up to 48 hours, we can leave the rooms alone. And right now, Mr. Casey has the disinfectant spray. So that will be done. And then if it's only those rooms and the school is still open, the other rooms are still in use, classrooms are being used, everyone else is still attending school except the affected people, then the custodian, your school custodian or custodians will clean the room or rooms. If the entire school had to be shut down by the Department of Health, then that would mean that your custodian is also quarantining with the students and staff of that school. And so then the DOE will hire a cleaning company, a company that we deem, Mr. Casey, Mr. Salters and I deem to be reputable, will come in and clean. So we do a walkthrough with the company. We show them what we're talking about. A deep cleaning is actually done, which means mopping, sweeping or vacuuming of the floor, mopping it, wiping all high surfaces, desks, chairs, doorknobs. I mean, almost anything you can look at will be disinfected. So it's quite a thorough job. And then we do a post disinfecting, a deep cleaning walkthrough. So we do the pre and we do the post. with the company, with the commercial cleaner.
Ms. Beach, if I can add that after you have completed the inspection, and notification will come from the Department of Health, the Environmental Division, to indicate whether, the room can be opened as well. So, and that kind of concludes the process.
Thank you, Commissioner. And also, I forgot to say, Environmental Health will also send a letter to seal the rooms officially. So we have a record of the affected room. So when Mr. Casey, Mr. Soltis, and I visit, if it's room 118, room 126, or whatever, and it's always the bathrooms that the affected people will have used as well. So if it's P5 Smith that had to be quarantined, then we look at, well, did the class go to PE? So now does the hall have to be disinfected? The bathrooms would always be disinfected. Okay.
Okay, and the final question is 511. I think this is for you, Mrs. Richards. It's about Power School. The teacher is saying she has tried to edit Power School to add in new contact data, and she can't to go back to the incorrect ones. Who are the people who can actually change the data in the student files? Is it just the admins or?
The administrator.
My understanding that it is the admin assistants who are able to change the data.
Okay. So teachers should inform the admin assistants for changes.
Yes, that is correct.
Thank you very much. I think that's it. Thank you all for your attention. If there's any more questions, you can use our feedback form, which is online. And I'm going to hand over to Mrs. Richards to close us off. Thanks so much for